America's secret healthcare crisis is about to blow up the economy, the stock market, your net worth, and your financial future. Speaking as an acknowledged expert on the health insurance industry, a sector Weiss Ratings is famous for knowing inside and out, I can tell you the following with confidence. Nothing you've seen or heard before lays out the real problem with America's healthcare system and what it could do to your finances starting today. And that's because the mainstream healthcare crisis narrative is simplistic, misleading, grossly understated, and pretty much everywhere you look, it's dominated by vague messaging we've all seen to the point of nausea, like families on Obamacare brace for higher healthcare premiums, NBC. Skyrocketing ACA premiums force enrollees to make tough decisions, CNN. Millions of soon-to-be uninsured Americans are looking for a Plan B, NPR. What makes matters worse is that a lot of Washington movers and shakers unwittingly promote this oversimplified narrative. Like Hakeem Jeffries, for instance, who sternly warned, House Democrats will strongly oppose any legislation that does not decisively address the Republican healthcare crisis. Or House Speaker Mike Johnson, who recently fired back saying, it is the Democrats' Unaffordable Care Act that broke America's healthcare system. But underneath all this rhetoric lies a terrifying truth. Only insurance company insiders know the true financial magnitude of America's impending healthcare emergency. They're scared to death to tell you about it, but I'm not. Because we're renowned insurance industry analysts. We know why big insurance is keeping us all, including our elected leaders, in the dark. It's because the real future cost of healthcare in America, starting at the end of this year, is a bomb that threatens to crash the U.S. economy and market, potentially more than 2008. To be clear, I'm not talking just about the numbers you're hearing from mainstream sources, like Obamacare premiums rising 26% this year on average. Sure, that's a big hit to consumers, but as you're about to see, it's just the tip of the iceberg. I'm also not referring to the tired old angles we've been hearing about for years, like aging baby boomers and other demographic shifts, or the increasing price of drugs and high technical medical treatments, the cost implications of obesity, diabetes, cancer, or heart diseases, changes in Medicare, Medicaid, and other entitlement-related reforms. Health insurance companies have seen these things coming for decades, and they've been steadily increasing premiums to keep pace with them. No. The healthcare bomb that I'm predicting will explode the U.S. economy starting this year. And it is trillions of dollars worth of health cost multipliers nobody could have seen coming until just recently. But no big insurance player wants to be the first one to alert Washington about it, let alone the general public. But right now, I'm going to show you no less than 5 detonators that could ignite this hidden healthcare bomb. Together, they could tally up to as much as $112 trillion in negative future impact to the U.S. economy. Number 1, tech-related job losses of up to $66 trillion. Some research suggests that AI, machine learning, and automation could wipe out as many as 100 million U.S. jobs in just the next decade. Other credible data indicates that technology could replace 30% of U.S. jobs within 5 years. Starting with the more conservative of these two projections, just to do the arithmetic, nowadays, America spends just over $11 trillion in total wages and salaries every year, which pay out around 164 million job holders. If 30% of these jobs disappear, that's 50 million job losses. That could cripple our economy to the tune of up to $16.5 trillion over just 5 years. If the tech revolution ends up closer to that worst case estimate, we'll see twice as many jobs disappear over the next 10 years. That would equate to a long-term financial impact of up to $66 trillion. Either way, these tens of millions of suddenly jobless people would still need healthcare. And somebody will be under massive pressure to pay for it. Which brings me to the next detonator with a burning fuse. Number 2, dementia and declining births. Over $41 trillion impact. Just to maintain the U.S. population at its current level, American women need to have at least 2.1 children each, on average. Nowadays, it's down to less than 1.6 kids per woman. And that spells big trouble for America's healthcare system. Believe it or not, based on today's tax rates and currency values, the difference between 2.1 and 1.6 babies per woman in America will be $6.5 trillion in lost future revenue for every 10 years that the birth rate stays this low. Over the course of just a single generation, that computes to nearly $17.5 trillion. On the other end of the life cycle, right now, over 7 million people in the United States are living with Alzheimer's disease. That's up by a shocking 32% in just 10 years. And by 2050, an estimated 13 million people will suffer from Alzheimer's. So today, the total economic burden of dementia and Alzheimer's to the United States is over $780 billion per year. And by 2050, the cost of care alone for Alzheimer's patients is projected to be more like $1 trillion, again, per year. Using the simple median between these two numbers as a conservative baseline and looking ahead by just one generation, the financial drain of Alzheimer's and dementia on the U.S. economy could total up to nearly $24 trillion. Combine that with a potential $17.5 trillion negative impact on our nation's flagging birth rate over that same time period, and we're looking at a total economic blow of more than $41 trillion in terms of both increasing costs and decreasing revenues. Number 3 is the youth crisis. At least $4.8 trillion impact. Right now, kids all across the country are caught in a firestorm. They're beset on every side by trials and challenges that my grown children and I never had to contend with before. And it's all putting another huge strain on the medical system. Consider this. 50% of U.S. kids have felt addicted to their phones. And 59% of their parents agree. 53% of America's teens now view cyberbullying and harassment as major problems. And in the 5-year period through 2021, gender dysphoria in U.S. kids went up by guess how much? 177%. Just 5 years. Gun violence among U.S. kids has risen 95%. It's the number one cause of teen mortality. From 2016 to 2023, mental health diagnoses increased by 35% among U.S. teens. The rate of suicides in young Americans aged 10 to 24 have gone up by 62% in recent years. 30% of high school seniors now use cannabis occasionally, but over 6% use it daily. And on these last 3 points, I just saw a study by researchers at my own alma mater, Columbia University, and guess what they concluded? They concluded that teens involved in recreational cannabis smoking were up to 4 times more likely to experience psychiatric disorders. We estimate that the long-term cost of these youth problems to both society and the American healthcare system could come to $4.8 trillion. Number 4, tariffs and trade wars between $500 billion and $2 trillion or more. Let's start with U.S. imports of pharmaceutical products. They've gone up every year since at least 2013, but 2024 saw the biggest annual increase on record, a jump of 20% year over year. And the worrisome twist in all this is that the total volume of the pharma goods we import from China rose nearly 37% year over year. Altogether, in 2024, our pharmaceutical-related imports were worth almost $213 billion, which is also the highest in recent history by a wide margin. Among all pharmaceutical products, almost 40% came from the People's Republic of China. And among active pharmaceutical ingredients, the APIs, over 70% also came from China. And we import billions worth of medical supplies and instruments from the People's Republic. Translation: in recent years, America's healthcare system has become more dependent on China, not less. And that was before big tariffs on imported goods became our new normal. Just for some basic perspective on this, a 25% additional tariff on pharmaceutical goods alone would increase drug costs in the U.S. by $51 billion per year. Over a decade, that would be $500 billion in extra costs to be borne by U.S. consumers and insurance companies. And depending on where tariff rates settle for the long term, it could end up being double this much or quadruple. Here's another twist. The U.S. gets 92% of its penicillin from China. Over 99% of its prednisone and lots of other common drugs too. If China retaliates by hiking prices on these medicines or weaponizing their pharma exports, consumer costs here at home could skyrocket even more. Number 5, medical care for illegals. Impact: up to $200 billion. Recent figures peg the cost of Medicaid-based emergency services for illegals at around $6 to $8 billion per year nationwide. But since not all states consistently report this data, the actual number could be much, much higher. And for some perspective on this, research from 2017 found that the overall financial impact of indirect or emergency medical care for illegal residents was over $20 billion per year. And guess what? There are millions more illegals in the U.S. now than there were back then. California alone is now projected to spend as much as $8.4 billion a year on medical care for illegal migrants. And just a few years ago, Illinois estimated needing $1.1 billion to keep their program for providing medical care to illegals up and running. Of course, it's impossible to pinpoint exactly how much the medical care of illegal immigrants actually costs our system at all levels, federal, state, local, and private, but it could conceivably reach the hundreds of billions of dollars over the next coming decade, especially since as many as 9 to 10 million more illegal immigrants have come to the U.S. in just the last 5 years. They're all going to need care for as long as they're here, and America will have to pay the price. So there you have it. 5 already burning detonators with a combined future economic dollar value of as much as $112 trillion. That's nearly 75 times more than the $1.5 trillion subprime mortgage flap that brought down the economy and stock market in 2008. And mark my words, beginning in the fourth quarter of this year, the American people are going to find out just how much of this incredible financial burden they're going to have to bear. Because insurance companies won't eat these costs. We, the people, will, one way or another. Why the fourth quarter? Quite simply because that's when health insurance premium notices arrive for the following year in your mailbox. And my prediction is that those premium increases for 2027 will be the anvil that breaks the camel's back.